Hello, my name is Leanne Flowers, and I'm going to be going over with you today some essentials of a laceration repair. So, some things that I want to start out with is just you want to start with an evaluation of your patient to making sure that they're an appropriate patient to do laceration repair in your office. You want to make sure that they don't need a surgical consult. So this would be a patient who would be, who would have really deep, multiple layered wounds, or penetrating wounds that we wouldn't know if there was any nerve or involvement of any of the joints or anything like that. And then also you would want to consult surgery if the wound was had a lot of heavy debris and a lot of drainage too. So once you've decided that the patient is appropriate for a laceration repair in your office, then you want to prep the wound. So the preparation would start out with some irrigation to make sure that the wound has no debris and is clean. You can use normal saline or tap water if you have it. Either one is fine. You just want to make sure that the wound has been cleaned and irrigated efficiently. So once you've done that, then you want to anesthetize the wound. Typically you use 1% lidocaine, and you want to go around the wound to make sure that the wound's been appropriately anesthetized. You can also use a lidocaine with epinephrine if you need more hemostasis of the wound itself. Areas that you would not use that in would be fingers, toes, penis, ears, or nose. And so you would want to stay away from those areas. So once you've cleaned your wound and then you've gotten it good and numb and you've used your lidocaine, you wouldn't want to go over 3 to 5 milligrams per kilogram, so you want to make sure you dose it appropriately. Then you're going to drape your skin, make sure you have a sterile surface, put on sterile gloves, and then we're going to talk a little bit about what type of suture to use and where to use it on what part of the body. So typically you have your absorbable and non-absorbable sutures. The absorbable are usually used in a mucosal area or multiple layer skin wounds, which we wouldn't be doing in the office. But your non-absorbable would be for the like simple lacerations on the skin, and you would also want to choose the type of suture. There's nylon, there's Prolene, there's Vicryl. So the Vicryl is normally used for absorbable lacerations, and the nylon is usually used for non-absorbable lacerations. So the bigger the number, the smaller and the finer the suture. So anywhere on the face, you'd want to use like a 5/0 to a 6/0. Extremities in the scalp, you would use a 4/0 to a 5/0. And the trunk, you'd want to use a 3/0 to 4/0. So this is going to be a simple laceration to the extremity. I'm going to use a nylon 4/0. I've already prepped my skin, and my patient has been anesthetized and is comfortable. And so now I'm going to go ahead and prepare to suture. So I would have gloves on and my hands would be sterile. My area would be sterile. You want to pick up your needle with your needle driver and you pull it out of your pack. So you have sterile gloves on, so you may have to adjust your needle on your needle driver to make sure that you're able to drive your needle into the skin appropriately. So you'll have some forceps, some tweezers in your suture kit to help to grab the skin and stabilize it. And you want to go in at a 90-degree angle. After you stabilize the skin, you're going to go in at a 90-degree angle, and you're going to try to get your needle to be even on both sides. And then you're going to pull it through. Once you've pulled your suture through, you want just a small tail on this side. You can lay your your tweezers down. You can lay your needle on your sterile surface at this time. And then you're going to make your first knot. So the first thing that you're going to do is you're going to wrap your suture around your needle driver twice. You're going to grab your tail and you're going to pull through, and you're going to pull it opposite. Then you're going to go back around the opposite direction, pull your tail back through in the opposite direction. And that gives you your first knot. Okay, and then you're going to do this a couple times until you get a good knot. And then you're going to make sure your knot's not over the wound, and then you're going to cut it with your scissors. So you're taking your gloved hand, everything. You want to take your suture and you want to cut it far enough where it's not going to be getting caught in the next suture, but it's tall enough to be grabbed when you go to remove it. All right, so then you take your needle driver. You're going to grab your needle again, and you're going to secure it in your needle driver. And you're going to repeat this process. So you want to stabilize the skin. You want to try to get it even. And then you pull your suture through. And then you set your needle down on your sterile surface. And then you're gonna make your knot again. So you're gonna go 1, 2. You're gonna pull through. And you're gonna go the opposite way. And then you're gonna pull through. I'm gonna do this a couple times. One, two, pull through, make sure that it's tight, and one more time. Okay. So the knot is not on over the wound. You can take your tweezers to help you pick this up, and cut your suture. So then you're going to pick up your needle again off your sterile surface, and you can adjust it. And so as you can tell, the knots are off of the wound, and then the skin is approximated on the inside. So that's 2 sutures. So we're going to repeat this a couple more times. Suture. Okay. You're going to wrap twice, pull through, and you're going to go the opposite direction and pull through. You're going to do that a couple more times. Make sure it's good and tight. One more time. And you're going to take your tweezers and you're going to cut your suture. You make sure your knot's pulled over. Then you're going to make your cut. Right, so you're just grabbing your needle up again and stabilizing your skin. So if you pull it through too much, you can correct it. Make sure that's secure. So you want to wrap twice, pull through and tighten it, and then go opposite, pull through, tighten, and do that one more time. Nylon is very, very thin. And one more time on the opposite. Okay. So your knot's not over the wound, it's approximated, and then you're going to cut it. So we've got 4, and we're going to do one more. So we're going to pick up our needle and then stabilize the skin. This will be our last one. Like I said, you can pull that through a little bit if you over pulled it. So you'll set it back down. You're gonna wrap twice, pull through, make sure it's good and tight. Then you're going to wrap once, pull back through, make sure it's good and tight. Make sure your tail comes all the way through. And then you're going to do that one more time. Where it's good and tight. And then opposite. Last one. So then I'm going to pick that up and we're going to cut it. Okay, so just to show you, all your knots are pushed to one side, your skin is approximated on the inside, and none of the knots are over the laceration. Okay, so I'm going to go ahead and talk to you some more about when they should follow up and how to take care of the wound. So generally, wounds, you're going to tell your patient to follow up according to the type of suture that you put in and where on the body you put it in. So face is usually 3 to 5 days. Pretty much anywhere else is going to be an average of 10 days. And then the soles of the feet and the palms of the hand are the longest to heal, take the longest to heal. So those tend to be 14 to 21 days. So that's when you're going to tell them to follow up. And as far as care for the wound, you want to stress the importance of keeping the wound clean. And they can just shower regular, pat dry. Then they're going to take an antibiotic ointment or a petroleum ointment. Either one is fine. They're going to cover the wound daily, and then they're going to put a bandage over the wound daily. They don't have to wear the bandage the whole 10 days, but at least for the first several days, you want to cover the site with a bandage. And then those last couple of days, they can just do the ointment until they come in to have the stitches removed. And so that's just some demonstration and clinical pearls on the essentials of suture repair. Thank you.